Okay, my name's Amber and I'm doing some education on ambulating post-op day 1 after surgery. This is for a project for Bemidji State and I work at the VA hospital. These are some of my coworkers who work with me, so I'll be educating them with it. So the purpose of this study is basically looking at fast-track ambulation versus delayed ambulation. And the reason why I'm interested in this project is because I think that fast-track ambulation is the gold standard of care. So some background on this is that postoperative surgical complications can prolong the rehabilitation of patients, and the incidence of complications can be decreased depending on the postoperative care. I think that it's important because I think that nurses are kind of the forefront of postoperative care, and so I think it's important for us to do education on it and also educate our patients on it. So, ambulating by postoperative day 1 for knee surgeries can significantly decrease the risk for surgical complications and reduce the total length of stay by an average of 4 days. Delayed ambulation and fast-track ambulation have both been considered the gold standard of care in evidence-based practice. So all of you guys have the handouts that I gave you, which talk about the purposes and the objectives of this. The first objective is that by the end of this presentation, you will be able to identify 3 reasons why it's the gold standard of care to encourage surgical knee replacement patients to ambulate at least 15 feet 3 times a day by postoperative day 1. You'll also be able to identify 3 postoperative complications that are associated with delayed ambulation, and you'll be able to identify 3 ways to encourage postoperative patients to ambulate at least 15 feet. 3 ways how to encourage them to be ambulating after ambulation. So the different research that I did on this was that I used 9 evidence-based practice articles, and I learned all about different studies that there were. I used 9 articles, and they're focus studies that teach on how to reduce the surgical-related complications and how to decrease the length of hospital stay. The largest study consisted of 240 patients, and the smallest study consisted of 50. So fast-track ambulation can reduce postoperative length of stay by at least 4 days. It's also known to decrease the risk of surgical complications such as pneumonia or deep vein thrombosis, and also the risk of falls. Also, with a 1-year study or follow-up of the study, it showed that there was a decreased number of patients who ended up enduring long-term post-operative issues. So the PICO question for this is, for surgical knee replacement patients, does ambulating by by postoperative day 1 decrease the risk for complications and the delayed ambulation? So different ways of what we can do to help them ambulate is make sure that they feel safe and that we're using the right equipment, make sure that we are adequately managing their pain, and to make sure that we're educating them on it so that they know why it's important for them to be ambulating. So the conclusion of this is that early ambulation within the first 24 hours after knee surgery is an inexpensive and cost-effective way, an effective way to reduce the incidence of post-operative surgical complications and reduce the entire length of stay. So now I'm going to open this up for discussion for all of you, because I know that you guys all want to learn and discuss about this. So can somebody tell me and identify why there are 3 reasons why this is the gold standard of care? You? No? Oh, Steven!
Well, first of all, it decreases the length of stay, so it makes
Yes.
it less likely that they're going to stay longer. Decreases the complications postoperatively,
Yes.
and also doesn't it decrease the risk for the long-term complications?
Yes, it does, and on a 1-year study up, that's what we learned. Thank you for that. And then the other objective that was good to learn was, can you guys identify 3 postoperative complications that are associated with delayed ambulation? Oh, Nikki!
Increased risk for DVTs,
Yes.
increased risk for falls,
Yes.
and increased risk for pneumonia.
Absolutely. And then the last objective is that we know that nurses are the forefront of nursing, and that we work hard to get our patients interactive with their care for patient-centered care. Can somebody tell me 3 ways that we can really encourage our patients to ambulate within the first day post-operative? Anybody?
Well, obviously, we're gonna educate the patient on why we want them to ambulate so quickly, that we wanna get them better and get them out sooner. Medication, we're gonna educate them on medications for pain, if they're worried about pain when ambulating right away.
So that they're
And we're just
comfortable.
gonna encourage
Yes.
them to ambulate and get better.
That's perfect. Well, does anybody else have any other questions or discussion points for this, or do you feel like that you were well educated?
Absolutely.
Awesome. I will send out a post test and we'll get that set up. Thank you all for your time.